I will be the circulating nurse for Miss Frederick's today for her surgery. The type of surgery performed today will be on her right femur. The first thing I'm going to go ahead and do is look into her medical chart and just double check some things, make sure things are all good before I go speak with her. So far it looks like the surgeon has gone in and done his checklist. Looking at her medical history, it shows the fact that she has no medical history, nothing listed that we know of, as well as her surgical history. She has no history of surgeries. As far as medications, there's none listed that she's taken pre-admission as well as currently. For her labs results, we have all her electrolytes have came back in normal limits, which is good before surgery. The surgeon put in orders for an HCG test to be done. That was completed and that test result has come back as negative. For her pre-op documentation, her orders are in as NPO. It looks like she's been compliant. She's not eaten since midnight and a CHG bath was performed when she arrived at pre-op this morning, as well as she was placed in a clean gown. There is also record and chart of her voiding. Knock knock. Hi, my name is Joelle. I'll be your nurse for today. I'm gonna go ahead and close my door. Do my hand hygiene. Can I go ahead and get your name and date of birth, please?
Jeanette Fardus, 9/18/1965.
I'm here because we're going to be doing a surgery on your right femur, which is fractured. Dr. Bob will be doing the surgery on you today. I'm going to go ahead and double check just to make sure that he marked that site that we're going to do it on, okay? And I can go ahead and see that he definitely marked the site. Have you gone ahead and signed the consent form? I've seen it in the chart. I just want to verify and make sure that, okay.
Yes, the one of the nurses was here too when I signed it.
Good. Do you have any family history of sensitivity to anesthesia?
No.
Are you allergic to any medications?
No.
Okay. It says so in the chart. I just want to go through the questions just to double check, okay? Are you allergic to latex or any environmental factors? That can be like pollen, dust, mold.
Just pollen.
Okay, so like seasonal.
Mm-hmm.
Do you have any food allergies?
No.
Okay. Have you had any surgeries before we go in today?
No.
Do you have a history? Okay.
No.
No metal pins or plates?
No.
Nothing you've had okay.
Just a bad hip.
Just a bad hip, just pain?
Mm-hmm.
Are you currently taking any medications?
No.
Have you taken any medications before admission today?
No.
Do you use any over-the-counter drugs, herbal supplements, or illicit drugs? Have you used that in the past? No.
No.
Patient's labs are normal for chart, and all the orders and pre-op medications have been administered on time. Have you had anything to eat or drink? I know we've said on the thing that you're NPO on the chart, but I just want to double check. You haven't had anything to eat or drink in the last 12 hours or since midnight?
No.
Do you have any conditions or previous injuries that you have any concerns about when we position you on the operating table?
No.
Do you understand the procedure that's being performed today?
The right femur for my fracture.
Yes. Do you have any comments or concerns about that?
No.
How are you feeling about the surgery? Are you anxious, worried?
I'm good.
You're
Who's
good?
my doctor?
Dr. Bob.
Oh, okay.
He's going to be your surgeon.
I know Dr. Bob.
Yes, he's a good surgeon. Have you had the CHG wipes done? The bath wipes, those are the chlorhexidine surgery prep wipes?
Yes.
And the patient is in a clean gown per the orders. Have you had a pregnancy test. Did we do the pregnancy test on you yet? Urine sample?
I think so, yeah.
Per their chart review, the result came back as negative. Do you have any questions for me? Oh, I have another question for you. I apologize. Do you have any open wounds or any scratches, cuts, anything that we need to know about besides the right fracture on your femur or anything?
No.
Okay.
I think I used the bathroom 5 minutes ago.
Okay.
So
That was next on my list, but I'm glad you answered it for me.
Oh, okay.
But if you do have to go again, that's good. You just did a urine output. That's it. Okay, good. Do you have anything else you want to tell me? Any questions, concerns? Can I do anything for you before we go back?
No, my family's here.
Your family's here. Okay, we can. Are they in the waiting room?
Yes.
Did you give them any do you have any glasses, hearing aids, dentures? Did you give them anything, personal items like that, significant items?
Yes.
To hold on to? Okay. We will make note of that. And we'll go ahead and keep your family updated as the surgery goes along, okay?
Okay, they wanted to know how long the surgery will be and how.
Are you okay?
And how long I'll have to stay in the hospital. Maybe when you have time you can tell them.
I can definitely have the doctor come down and talk to them. If they have any specific time concerns or any concerns about the procedure in general. We can all have an education time, just so that they know time during surgery and then post-recovery and what to expect when you go home. And we can include you in that as well, just so you know as well, and then we can all just sit down and have a good family meeting. Is that okay for you?
Yeah, thank you, Joelle.
No problem. Can I do anything else for you right now?
That's all. That sounds great. Thank you.
Okay. Well, here's your call light, and I'll be back in a little bit, okay?
Thank you.